day, viewers, and welcome to today's COVID-19 update with the Honorable Minister of Health, Dr. Frank Anthony. Dr. Anthony, thank you for having this update with us this afternoon. First of all, more of Russia's COVID-19 vaccines are expected to arrive in the country sometime today. This, of course, will strengthen our capacity. Can you talk to us a bit about the plan going forward from here?
Well, we are expecting 83,000 more doses of the Sputnik V vaccine to come into Guyana. Originally, we were thinking that we'll get them this week, but because when we look at our logistical plan of how to bring them in, those vaccines would be arriving early next week. So, but we're moving forward. We are going to get more vaccines. As you know, we've already had in country 55,000 doses of the Sputnik V. And with this additional 83,000, this is going to help us to get more Guyanese immunized. So we're moving ahead. Our vaccine uptake has been quite good. As of yesterday, we had more than 70,000 persons who've already received their first shot. And those who took the Sinopharm vaccine, many of them are now becoming due for their second shot. So once they have their second dose, they will become fully immunized. So I think so far we have made good progress. We have teams in every region in Guyana that is working on the vaccination program and going out to different communities and immunizing people.
Okay, with regard to the more than 67,000 people who were vaccinated so far, what is Guyana's current ranking Caribbean-wise with regards to vaccination?
Well, that's a good question. I would imagine that since most countries in the region were depending on COVAX for their vaccines, that they were not able to immunize a lot of people in their countries. So we have had some vaccines from COVAX. We've had 24,000 doses. But in addition to that, we have benefited from vaccines coming from India as a donation. We had 3,000 doses that came from Barbados. And we have bought the Sputnik V vaccines. So we have been able to acquire more vaccines than just depending on the COVAX facility. And that's why we have been able to advance our immunization program. A specific ranking, it would be hard to know, but I think we're in a good position in terms of trying to immunize our population.
Okay, more closer to home, Suriname recently announced that there is some quarantine requirement for persons traveling to that country. Is something similar planned for Guyana?
No, our policy in terms of international travel into Guyana has always been that persons would be required to have a PCR test done. And once that PCR was done within a 3-day period, then when you arrived either Chedijagan or one of the ports, that you would be allowed to continue without having to be in quarantine. If, on the other hand, your vaccine was more than 3 days, but within that 5-day period, then we would allow you to come in, but you will have to do a second test upon arrival here in Guyana. So that has been our protocol, and that has worked well for us. We have been able, using that protocol, to detect about 49 imported cases. And once we detect those persons, we have been able to isolate them so that they can go through a quarantine period and make sure that they don't bring the infection into Guyana. So that has been our protocol. We haven't changed that. So while Suriname has changed their protocol for the travelers on the ferry, we will still retain our current protocol.
Okay, and finally, Dr. Anthony, Region 9, Aishalton, the Armenian community of Aishalton they have a lockdown. Do you know how long that will last and what prompted the lockdown in the first place?
In Region 9, we have two communities that currently have active cases. We have in St. Ignatius, we have 10 active cases, and in Ishalton, we have 9 cases. Now, the village council in Ishalton decided that they're going to have a lockdown. They may have had some consultations with the health personnel in the region, but we certainly did not advise them to lock down the village. That was something that was done by the village council. So they are taking their own precautions, and in whatever way we can support them, we will do so. But that's the village council who is taking that decision. As you know, we have seen many cases in different areas, and our approach has been slightly different because once we are able to identify those persons who are positive and quarantine them or isolate them from the rest of the population for at least a minimum of 10 days, uh, then we know that those persons would not be transmitting the infection. So once you have proper monitoring, there's no need for this stringent type of lockdown. Nevertheless, this is a decision that the village council has taken, and we have to respect those decisions.
Thank you very much, Dr. Anthony, and thank you for today's update. Well, viewers, that's it for today, April 15, 2021, the COVID-19 update with the Honorable Minister of Health, Dr. Frank Anthony. Remember to join us every day for a COVID-19 update, and for added information on the COVID-19 pandemic, you can always visit the Ministry of Health's website and dpi.gov.gy for more information. I'm Natasha Smith-Thomas. Thank you for watching.